The U.S. hit a new daily record of COVID-19 infections with more than 144,000 reported yesterday. Hospitalizations topped 65,000 for the first time. 22 states are reporting more hospitalizations than at any time since the pandemic began. Deaths are up by 22% from a week ago. Let's look at how this is hitting a number of states, especially hard, no matter which region. In El Paso, Texas, makeshift clinics outside hospitals are opening up. Mobile morgues are moving in, and a lockdown of non-essential businesses has been extended. Testing lines are growing in Wisconsin. Cases there have jumped from 700 a day to more than 6,000 in 2 months. To deal with its surge, Chicago's Mayor Lori Lightfoot issued a 10-person limit on social gatherings and a stay-at-home advisory for non-essential needs starting next week. And in South Dakota, the highest hospitalization rate in the country. 1 out of every 1,600 residents is hospitalized with COVID. We asked a small group of Americans how these surges are affecting their lives.
My name is Dave Caton. I am a registered nurse at the Medical Intensive Care Unit and the COVID Intensive Care Unit at United Hospital in downtown St. Paul.
My name is Valerie Skurdlant. I'm from Des Moines, Iowa, West Des Moines to be exact, and I'm a stay-at-home mom.
My name is Jared Berger. I work in the culinary department at a senior living community, and I am in Sioux Falls, South Dakota.
My name is Jennifer Carey, and I am a substitute teacher. I live in Mandan, North Dakota.
My name is Caroline Long, and I am a special education teacher with Minneapolis Public Schools.
My name is Marie Cheslick. I'm a registered nurse in Chicago, Illinois.
I feel like I'm drowning. It's gotten to the point where in the last month, for sure, we've been completely full in the hospital. Every single COVID designated room has been full. And even last week, we had every room in the intensive care unit was full, and we would just get patients rolling onto the unit with no open room to go to.
I got sick on October 13th, and within a week, I found out that my husband, daughter, his best friend, and about 10 other people all became positive within a week's worth of time.
Every potential exposure that I have is a potential exposure to every single one of the 140 residents that I have to help make food for. And at the end of the day, the way I think about it is, would I be able to sleep at night or live with myself knowing that I could have potentially given this to somebody who couldn't fight it off?
I find myself running, and not finding times for breaks. And again, sort of normal on a perspective of being a nurse, but the way that it's happening with COVID right now is that it's nonstop.
There have been all of these reports that, it has a negative impact on communities of color, and having pre-existing health conditions myself, and then being a woman of color, then I really worry about that.
In a family-oriented state like Iowa, it's very hard. It's very stressful, and it makes you feel like there will be some days where I feel like I'm the only one on board, or maybe me and just a few hundred people that live here are taking it seriously.
It's only seeming like it's getting worse. And I'm afraid for the future. The burnout is from knowing that it's not getting better.
You would generally only see maybe 10% of people wearing masks. They do not social distance. In fact, if you do wear a mask, you're often looked at like, oh, it's that crazy person who doesn't know how to live life.
It's unfortunate that this pandemic has been made such a political argument. And I don't think that needed to happen, because it's really about the safety of lives, the safety of people.
I can be there for my patients, but more and more, it's less of bedside, being there emotionally and physically for that person. It's being there on a very strict medical level.
I'll have a few days at a time where I just don't even leave the house. All I do is literally drop my son off at school and then pick him up, because I just want one less body out in the world that can be potentially getting this or spreading this.
I have held the hands of patients as they are dying. And I've had to tell family members that they can't come see their family members because they could potentially get the virus or spread the virus. And it's awful.